All right, welcome to The Explainer. Today we're going to dive into the incredible world of obstetrics. Our goal? To connect the amazing, complex science of childbirth with the very human story of care that goes along with it. Let's jump right in. So let's start with a big picture and look at the state of maternal health right here in the United States. You might be surprised to hear that despite all our medical advances, we're facing some real challenges when it comes to keeping birthing parents safe. Just look at this number, 20.1. That was the U.S. maternal mortality rate back in 2019. Now, what that means is 20.1 deaths for every 100,000 live births. And the really concerning part? This number has actually been going up, not down, putting the U.S. in a tough spot compared to a lot of other developed nations. But this isn't a problem that affects everyone in the same way. Not at all. The outcomes can be wildly different depending on where you live. Think rural areas versus cities. And on top of that, we see these huge, persistent gaps across different racial and ethnic groups. Okay, so to really get why these healthcare challenges are so important, we have to first appreciate the biological masterpiece it's all built to support. So let's zoom in from that big societal view, right down to the level of the reproductive cycle itself. The whole thing, from puberty all the way to pregnancy, is basically run by this incredibly elegant, super complex conversation between hormones inside the body. It's kind of like a biological symphony, with a few key hormones acting as the conductors. And it all kicks off in the brain. The pituitary gland sends out these two really important signals. One is called follicle-stimulating hormone, or FSH, and the other is luteinizing hormone, LH. You can just think of them as the monthly go signals that basically tell the ovaries, hey, wake up, it's time to get an egg ready. And you know what? The ovaries listen. When they get those signals from the brain, they start producing their own hormones, estrogen and progesterone. And these are the real workhorses. They're the ones that build up the lining of the uterus, making it a perfect, welcoming home for a potential pregnancy. So, altogether, these hormones are what drive the female reproductive cycle. It's this beautiful, rhythmic process of maturing an egg, releasing it, getting the body ready for a baby, and then, if it doesn't happen, it just resets and starts all over again next month. But what happens when conception does occur? Well, that's when things get really interesting. It kicks off one of the most amazing and intricate developmental journeys in the entire natural world. This whole journey happens in three main stages. First, you've got the pre-embryonic stage. That's the first 2 weeks. Just a whirlwind of cell division while it travels and implants in the uterus. Then comes the embryonic stage, from week 3 to 8. This part is so critical because it's when the basic blueprints for all the major organs get laid down. And after that, it's the fetal stage, which is all about growth and getting bigger and stronger right up until birth. Now, sitting right at the center of this incredible 9-month journey is the placenta. I mean, what a remarkable thing. It's a temporary organ grown completely from scratch for one single vital job, to be the baby's total life support system. The placenta wears so many hats, it's unbelievable. You can really think of it as 3 organs in one. It's a metabolic factory cooking up nutrients, it's a transfer station bringing oxygen in and taking waste out, and it's an endocrine powerhouse, cranking out the hormones that are absolutely essential to keep the pregnancy going. Here's something really cool. Since a fetus is getting all its oxygen from the placenta, not from breathing air, its circulatory system works completely differently from ours. It's got this totally brilliant series of shortcuts, or shunts, to make sure the most oxygen-rich blood gets to where it's needed most. These 3 shunts are just feats of biological engineering. You've got the ductus venosus, which bypasses the liver, the foramen ovale, which is a little shortcut between the heart's chambers, and the ductus arteriosus, which connects 2 major arteries. And the whole point of this setup? To make sure that the best, most oxygenated blood from the placenta gets sent straight to the most important organs first, the brain and the heart. Okay, so we've gone deep on the biology of how it all works. Now let's zoom back out to the human side of things and talk about how people navigate this reality through family planning. When it comes to contraception, there's really no one-size-fits-all solution. The choices are vast, from things like an IUD that can work for years, to daily pills, to barrier methods like condoms. The whole key isn't about finding the single best method out there, it's about finding the best method for you, one that fits your health, your lifestyle, and your future plans. And of course, a huge part of making that choice is safety. And one of the most critical safety messages in all of family planning is about the combined risk of smoking and estrogen. For people who smoke, especially if they're over 35, using contraception that contains estrogen seriously increases the risk for things like blood clots, stroke, and heart attacks. It's a big deal. But supporting people on this journey safely isn't just about knowing biology and medicine. To do it right, you have to have a deep understanding of the whole person, where they come from, what they believe, and what matters to them. And this is exactly where something called transcultural nursing becomes absolutely essential. It's all about getting away from a cookie-cutter approach. It means providing care that's genuinely sensitive and respectful of a person's background, because that is how you build trust and get the best, safest outcomes. And it can come down to things that seem so simple, but have totally different meanings depending on your culture. Take eye contact. For some, it signals honesty. For others, avoiding it is a sign of respect. The same thing applies to physical touch, or even how people think about time and appointments. And here's a huge one for anyone in healthcare. Who gets to make the final decision? In some families, it's the individual, no question. But in others, it might be their partner, or the family elders, or even the whole community that weighs in. Figuring that out is absolutely critical to providing care that actually works for that person. And this powerful idea of inclusive care goes way beyond just culture and ethnicity. It means creating a space that's welcoming for absolutely everyone. That includes LGBTQ families, for instance. And it can be as simple and as powerful as asking for and using someone's preferred name and pronouns, and just recognizing that families come in all shapes and sizes. And really, that brings us right to the heart of it all. Understanding the biological miracle of birth, from that hormonal symphony to the powerhouse placenta, well, that's only half the story. The real challenge for all of us is to build a healthcare system that is truly worthy of that miracle. A system that's safe, equitable, and respectful for every single person. So the question is, what does that system look like to you?